Hello, welcome to the lecture, and I'm Thomas Ming-Shui Chang. I've been working in artificial cell for more than 60 years. It's a pleasure to briefly summarize this area for you. First, let's ask the question. The beginning attempt and innovation is done whereby artificial cell of nano-thin membrane can be entrapped with cells, hemoglobin, enzyme, magnetic material, adsorbent, and other things. It's separated from outside, molecule can go in, active part inside, and then come out. Now, going further now, at present, you can in fact put in all sorts of material, artificial, biological, or active material, as you can see. So there's unlimited content. In my 1972 monograph on artificial cell, I emphasized that artificial cell is just an idea. Much physical configuration are possible. Indeed, in the last 10 years, there has been extensive increase in configuration as extension, improvement of the idea are being made. Within a few more years, it's expected that much more configuration would be possible as the area is extended and improved. This is an example of the possible uses. I'll let you look at it. Microdialyser, drug delivery, blood substitute, biotherapeutic, vaccine, cancer therapy, immunotherapy, enzyme gene therapy, cell therapy, biotechnology, nanotechnology, regenerative medicine, agriculture industry, nanocomputer, nanobody, nanosensors. So let's take some of these as example to discuss. This is the micro or nano dialyzer bioreactor based on nanotechnology and nanomedicine. Let's look at an artificial kidney. Complex, useful machine, large, expensive. Let's ask the question, 10 cc of artificial cell with 10 nanometer thin membrane, how does it compare to an whole artificial kidney as far as mass transfer is concerned? Let's look at mass transfer. Artificial kidney is 1, and the artificial cell of different diameter is shown here, and the mass transfer is shown here. When it's about 100 micron diameter, the transport rate is 100 times. What it means is that things can go through the artificial cell very quickly. However, with 10 cc, there's very limited amount of diffusion can take place. So as a result, we can put in different things to make these into microdialyser / bioreactor. Therefore, things going in would not be equilibrated because they could be removed or acted on by the content. Let's look at adsorbent. Adsorbent, you can put a membrane around it, 10 nanometer thick. This way, permeant toxic substance can go in, particulate doesn't come out, cell cannot be removed. But so let's look at this in 70 gram artificial cell with adsorbent, and each of these is shown here. This column is schematic with millions of artificial cells. A patient, if you put in blood, the blood would go through, cleanse, and return to the patient. Let's look at how it works. The artificial cell compared to artificial kidney, 70 grams. This is a patient admitted with 3 times the level of the sleeping pill, comatose, in shock, the heart stopped a number of times. When you put artificial kidney, it doesn't remove the drug, so they asked me to go and use my artificial hemoperfusion. When I put it on the patient recover blood pressure and reflex and fully recover. When we analyze the drug level, it shows that it comes down very quickly. There was also an infant that accidentally given overdose of theophylline for asthma, and the level was very high and it could cause irreversible brain damage. As a result, they asked me to put this on the patient. The level came down very quickly and the patient recovered. I have done about 11 of these and it all worked well and FDA approved it. We carry out clinical trial on chronic renal failure patients lasting up to 8 months, and this approach was approved by FDA for device. This is a 2017 book showing that it's now being used around the world for treating poisoning, endotoxin removal, kidney liver failure, immunological diseases, removal of unwanted cells, and more recently, Jafron has used it to treat COVID-19 cytokine storm, resulting in many people recovering. The first one company started up in Montreal in 1980, 2010, Jafron in China is producing different types of hemoperfusion devices and is now the 3rd largest Chinese medical. Finally, may I invite you to visit the website. We don't have time to go into any detail. This is just a very brief summary. If you are interested, the detail in articles, videos, and books are available. If you have any question, I'll be happy to answer, and this is my email address.